Cancer Day, and we have with us Dr. Harit Chaturvedi, who is the chairman of Institute of Oncology at Max Saket in New Delhi, and is also looking after all the cancer units of Max across the country. So welcome to our show.
Thank you.
When we talk about Cancer Day, which we are celebrating today, and we know that in male we still have cancer of the lung, which is becoming number 1, and then cancer of the head and neck becoming number 2, and then comes the prostate cancer. And in women we still have cancer of the breast and cancer of the cervix almost equating. In the urban metro area we have cancer of the breast, and in the third number we have seen gallbladder, which one is rising, and cancer of the pelvic areas, ovary, and the uterus, which is rising.
In metros, the breast cancer is on the rise, cervical cancer is going down because of lifestyle influences. We see delayed pregnancies, we say less lactation and these practices in the upward mobile women. At the same time, cervical cancer is going down because hygiene is better, parity is low, the infection rate is less, so there are more certainly than
If I really want to be concerned today in the private sector, then I need to be more concerned about the breast cancer, which is rising. Now, in early stages, breast cancer is curable?
Almost curable. Stage 1, 90% cure rate, stage 2, 80% cure rate, 75-80%.
So how to pick up at the earlier stage?
Yeah. So one is any woman above the age of 50 years have 2 yearly mammography or yearly mammography, or between 40 and 50 also mammography, because that is screening tool. That is for healthy population. Besides that, any symptomatic person, whether it's a lump, nipple discharge, pain, discoloration on the skin, heaviness or change in size of the two breasts, any, or in something in the armpit, you can feel a lump in the armpit, all these things warrant a thorough evaluation. So thorough, what does it mean? It means evaluation to logical conclusion. Now we know of mammogram, we know of ultrasound. What I want to inform that mammogram can miss 30% of cancers. So just a mammogram or an ultrasound is not good enough. FNACs also has its own limitations, especially if it is not under image guidance. Normally now we are doing all in biopsies under image guidance, so that we take the sample from
FNAC versus biopsy.
So we must do a true cut biopsy. FNAC has no role now. But it is much simpler, accessible, that is why people are doing it, and I don't think it will go away so easily. It will have its place, but the recommendation is to do a true cut biopsy.
Now we have two cases. One is breast cancer, no metastasis. Second is breast cancer with metastasis. How do we?
Yeah. So for all cancer treatments, whether it is breast or oral or lung or anywhere, there are 3 well-defined steps. First step is a diagnosis. Diagnosis means type of cancer and organ of origin. For example, in breast cancer, for me, breast cancer is organ of breast, type is IDC, ductal carcinoma, invasive ductal carcinoma. We also look at ER, PR and HER2 status. What is the estrogen receptor status and HER2 status? Then we go to the stage of disease. Now if it's an early breast cancer, stage 1 and 2, the main treatment is local therapy. That is surgery with or without radiation, depending on the type of surgery, plus adjuvant treatment. That means chemo or hormone, depending on whether node positive, tumor size, receptor status, age of the patient, all that is put together, and then the decision is taken whether she needs adjuvant treatment or not. When stage 3 comes, typically we need all 3 modalities. Surgical, radiation, chemo, hormone, everything is required, because that is locally advanced cancer generally. And so therefore, once you have done the diagnosis and staging, you take a call that this is the treatment for locally advanced. There you can decide whether to start with chemo or to start with surgery, depending on certain situations. Then we are talking about metastatic, that is stage 4. So stage 4 is largely treated by systemic treatment. That is hormones, as in her case, Femara she is taking, or chemotherapy. It's a hormone not sensitive tumor. Then chemotherapy or Herceptin or something is given. Besides this, local treatment for symptoms. For example, she had radiation for backache. Somebody has pleurodesis for pleural effusion. Somebody may have brain radiation for mets there.
From female we go back to the male, and the number 1 cancer is lung cancer. When I was doing my MBBS, we were told lung cancer means 6 months. With treatment, without treatment. What is the scenario today in the lung cancer?
So scenario is not as good as it should have been or it could have been, but it's not the same as you said. It's not that bad either. So today, yes, we see only about 15-20% of lung cancer in treatable situation. That means less than stage 4, stage 3, 1 or 2, only 15-20%. still 80% comes in stage 4. And the reason is there's no screening. And in our country, largely speaking, patients who present with cough and have a shadow in the chest, they are started with anti-tubercular treatment. So that is the area where we lose all this. Having said that, today, by virtue of better understanding of tumor and better mapping of the iceberg, I say, because earlier what happened, whenever you saw anything which is spread or any lesion, the fear, as you said, no, nothing to be done. 6 months has either ways, so let them do what they're doing. Today, by PET scan and MR and all these things, we can actually map it very well. What is the extent of disease? You can pick early disease and then you can plan treatment. For example, if we see a stage 2 or stage 3 lung cancer, we do EBUS, we do further staging, accuracy goes up. You take a sample. If they are very sensitive, by some markers are there which are very sensitive, then you can channelize the treatment by chemotherapy only, no surgery.
Then from lung cancer, you go back to the oral cancer, which is still number one cancer, specifically in the rural area, which is related to
chewing tobacco is the culprit. Yeah.
Message for my patient and message for GP.
So message largely is that chewing tobacco, chewing pan masala, chewing all these material which causes submucous fibrosis, ulceration, and is ruining our generation in a way because of rampant use. And 85% of tobacco users in our society are in smokeless form.
A person who is a tobacco chewer, at what stage you should go for an examination? Ideally every year, but at what level?
Ideally every year, but if there's an ulcer, if there's a restriction mouth opening, if there's discomfort or pain or mobility of tongue or all these things, any such thing which is beyond 2 weeks, you have to have a proper examination.
Are there any general examination people can do special light or
so I would say
acetic acid test in the
no, I will not advise on that. No, it is the expert's eyes which is critical.
Now, in the third cancer, if I have to talk about in India, the male, from lung cancer to the oral cavity, the prostate cancer.
Yeah.
And which is now, we have two forms, the progressive form and the non-progressive form. There's always been a controversy that in a non-progressive form you can leave it.
Yes.
And in a progressive form, whatever you do, nothing will work.
Yeah.
So how do we diagnose? Is there a role of PSA screening? Is there, what exactly?
So PSA, if not used wisely, has also caused a lot of harm. Because a lot of people get unnecessary treatment. As you talked about the non-progressive form, or you can select your patients who can be observed safely. So typically PSA, velocity, age of the patient, all this is put together, and then we realize that who are those, and the Gleason score, that which are the group. In a low grade tumor, we need not do anything and just observe in a 75-year-old. Whereas in a younger patient, even for low grade, we'll advise intervention and treatment. So that is, as far as the PSA is concerned, it is kidney cancer.
And is there any specific reason for kidney cancer?
Smoking is attributed partly, but the exact causes we cannot.
Versus bladder? Bladder we...
Yeah, in bladder also smoking is a culprit. So tobacco itself, from oral, lung, kidney, bladder, pancreas, even breast for that matter, cervical cancer, it has far and wide effect. So besides that, not specific reasons, some chemicals are talked about.
How common is now the cancer of the stomach in the country?
Very common. In fact, gastric cancer is number 1 in southern India in male population after oral, and in northern India it is 5 or 6 level.
Okay.
It's
and
not
what is the cause? Is it?
Basic cause we don't know, but the incidence is high in Chennai because of the high usage of roasted fish. The coastal people, they roast their fishes and eat. So that is where the fish protein gets broken down into nitrates to nitrites, and that is carcinogenic.
Now, how common, we come back to the colorectal cancers. In the US, they are large number.
Very large, European population.
But in India also the number is rising.
Rising, but less.
But less.
And that is related to diet. Because still our diet has good amount of fiber. In the Western population, the non-vegetarian diet is the bulk. And that is very poor in fiber. So that is why we see that our numbers are less.
What about double cancers? Nowadays we are seeing a lot of cases.
Very common.
One is radiation induced, second is non-radiation induced.
So de novo 2 primaries or second primary is as high as 25 to 30% in head and neck cancers. So all those people who have once oral cancer or tongue cancer, they are on follow-up with one more purpose, that is rule out any possibility of cancer in either part.
What about breast cancer?
Breast cancer, the contralateral breast, the incidence is up to 1% per year. Remember that, non-breast cancers. Okay. So in breast, ovary, endometrium, colon, these three are associated. So if you have a breast cancer, then you have to screen for these also.
If I have to end, what are the 7 or 10 points which every GP must know, and 7 or 10 points every patient must know about cancer prevention?
Okay. So first thing I would say that cancer symptoms are not unique. Just as in heart attack, you have chest pain, and so lot of people can.
So here I have a formula: anything unusual,
anything unusual,
anything for the first time, anything which cannot be explained, don't ignore.
Don't ignore for more than 2 weeks. It's the job of the oncologist to work with the practitioners and ensure that the fear about cancer goes away. Today what happens, a person who gets treated for cancer, when he goes back to the society, nobody will touch him, nobody will take responsibility, because the fear is that something happens and I don't know how will I handle that. So you should be able to pick up the phone, we should be able to respond properly and connect so that we can serve the society better. Other things are that certain preventive things. Tobacco is a very big area which is very low hanging fruit. So if all of us empower ourselves and say that okay, we'll educate people on tobacco front, I think we'll do good. Regarding diet, if we encourage people and educate them on diet, it will do good. Exercise. So all these things can help us empower the society and turn it around.